So much talk about Thursday night football with the Broncos in prime time tonight down in New Orleans. But since our 9 News health expert, Dr. Payal Kohli, is here, we want to talk about the injuries in the sport because they often become the headlines.
Yeah, they do. 9 News medical expert, Dr. Kohli here. So we talk about the injuries, and football does kind of get a bad rap because there's injuries in lacrosse, there's injuries in baseball, there's injuries in hockey.
I don't know if it's a bad rap, though. Football is a violent game.
But football is so violent, and we hear about concussions and ACLs and everything. So all of those are probably the injuries that you hear about. Which one scares you the most? The concussions?
Tom is right. I mean, football is one of the most intense sports that we play and therefore most prone to injury. So if you think about how we play football, it's the lower half of the body that gets more injuries than the upper half, except for the head, of course, which can take impact. But the top 3 injuries that we see are sprains, strains, and concussions. So a sprain, and you think about it like an ankle sprain, is a ligamentous injury. So ligaments connect bone to bone. So knees and ankles. So you can tear an MCL, an ACL, you can have an ankle sprain or so. And usually those are healing on their own. Sometimes they'll require surgery if they really have a tear or something like that. But if it's just a little bit of inflammation or swelling, it can go away. Then there's a strain. These are muscle injuries. This is where the muscle, the hamstrings being the most common, but also the muscles in the groin and the inner thigh.
You always hear about hamstring goals.
Well, you know what's the new one? It literally didn't exist when I used to cover sports all the time, but now I hear all the time about oblique injuries.
Yes.
And back in the day, they never had obliques. Because you never heard of an oblique injury.
Well, they had them. They're just buried under all that fat on their tummy.
But obliques are it. So what I want to ask you, though, about is you talk about muscles and ligaments and things, bones even, broken bones.
Tendons.
All those things can be diagnosed pretty, to the nth degree and repaired. Head injuries, though, you're talking about a whole different thing as far as grades of concussions and that long-term specter of CTE.
Yeah, it's really difficult. Like you said, if you have a sprain or a strain, you stick them in the MRI scanner, it's pretty definitive. But when it comes to a concussion, it's tricky because the diagnostic criteria are really tricky as well. So, how do you diagnose a concussion on the field? Is it loss of consciousness? Well, no, because you can have a concussion with or without loss of consciousness. Is it neurological symptoms? Well, you can have neurological symptoms that can be transient. It's a dysfunction of the brain is how we define concussion, and it can be any part of the brain. So head trauma causing dysfunction of the brain. And in fact, a concussion can last about 2 weeks with symptoms. If you start to have symptoms beyond a month, that's when you're developing something called post-concussive syndrome. But as you pointed out, Tom, repeated injuries to the head, especially without time to heal in between, can set you up for CTE. If you're younger or have had a longer career. And then there's this kind of factor about genetics that we don't understand. And some people will get CTE if they get repeated concussions.
So we were talking about the Broncos, like Pat Surtain went out, and that immediately the NFL has a really strong protocol. But if you have a young person playing this sport, you would suggest taking them to a clinic or a hospital to make sure you get because that looking in the pupils and things like that, I don't know how to diagnose that.
Well, and it doesn't, depending on the part of the brain that has the concussion. So you can affect different parts of your brain depending on where the trauma is. The swelling can mean different parts of the brain, and we don't always scan people. And a scan could potentially be normal and still have concussion. So 100% of the time came out. If you have a college kid or your own child plays sports and they've had a significant head trauma with any kind of symptoms, confusion, kind of slowness in speech, nausea, slurred speech, or even chronic headaches, I really think it's important to see a neurologist.
Well, we're going to watch the game tonight. People continue to watch football. The football tries to regulate a lot of the injuries out of the game, but the speed and size of players, it just makes it a game that, as we talked about, it's a violent game. We'll keep an eye on. Hopefully it's an injury-free night tonight.
Well, and I will say all those most exciting passes where they're twisting or they're reaching or there's impact with the ground or with another player, those are the ones that cause the most injuries.
A lot of plays where
you're
you
not fun to watch a game with, I bet. You're like, oh.
Collarbone. That's ACL. Thanks. You can also get more with Dr. Kohli at 9news.com/Dr. Kohli.